Welcome to a Q&A with the Diversity, Equity, and Inclusion Workgroup. I am joined by Deneen Green Rivers, Patrick G., and Ayadola Anashe, who are all members of the DEI Workgroup. I'm also joined by Libby Hoy, founder and CEO of PFCC Partners, and all four of them will be answering your questions from the February PFCC Partners Community of Practice workshop, where the entire group talked about the challenges, lessons learned, successes, and hopes for DEI in the future at PFCC Partners. Our first question that came in was, how can individuals best partner as an ally?
I'll take that.
All right.
For me, one of the best ways to be an ally is to, you have to look within yourself, see your particular biases to certain issues and things around you, and address yourself before you can address any type of issues. And that tends to be really difficult because nobody really wants to do a self-assessment, but we all need to do it, irregardless of race, ethnicity, gender, or wherever we are in life. Once we start with ourselves, and then we just need to look at the world. We need to see the things that are going on. And we live in a country that if you look at the doctrine, it's about justice for all. I mean, it's written in our laws, it's written in the Constitution, yet we don't always execute that equally and fairly. So I think if we start with a self-assessment of ourselves, look at our particular biases, try to figure out why we have those biases. Some of those things could be based on core values, the way we were brought up, things like that. And then just start looking at our circle of influence, start looking at the world and seeing how the world opens up. I really believe that change can really start from that particular point.
Yeah, and I'd love to jump in. I think when we really dove intentionally into this work, for me, being a white woman of privilege, it was really about being humble and learning and taking in information and listening and hearing people's first person, and also doing the assessment, as Patrick mentioned, and looking at information, looking at evidence, looking at history, and laying down any defenses. You had to really just be humble and recognize this is the reality. And I think a humble perspective makes this work of being an ally a bit, I'm not going to say easier because it's not easy, but a bit more authentic, I guess.
I have friends who are from different walks of life, who have different privileges, who feel like they cannot, their allyship is different, like they cannot work directly with certain groups of people because maybe they feel like the privileges don't match. And I tell them, well, do the research. What happened to being culturally competent, learning about different religions and organizations, how people move, how they carry themselves in communities, learn about the communities, like have a nice deep dive in. And I think sometimes we forget that to be an ally is also to be a friend, how to be affable and attentive and approachable. And sometimes I feel like most persons who want to say they're allies, especially for people in the Black community, they don't know how to approach people who aren't like themselves. And so approachability and being attentive and thoughtful and accessible. And accessible for allies could mean something different. And accessible for me and persons I know in my community, look at accessibility, like how do you apply not just your privilege, but your overall, your time, your talents, and all of your treasures? Like, how do you truly apply that? Do you keep it within the bubble of the community where you feel safe? Or do you really take your privilege and all of your talents and you step foot in to the communities that you want to work with and in? So accessibility is really important. Being attentive, being approachable, being actively participating one-on-one with people like me, who look like me, is truly important. So I don't ever want people to think that you can be an ally and be surface or be at a distance. I like dive in. Like we want to be connected, and we see ourselves all as human beings. And we truly, I would like to say, people in the Black community, we love learning about all cultures, and we are so accepting of people coming in and wanting to work with us genuinely. So just remember to be affable.
One of the things I think that we're all getting at is that allyship is really about relationships and connection, right? And what Patrick was saying is it's about the relationship and connection you have to yourself and understanding who you are, where you come from, what your biases are, and how you want to move forward, right? And it's a continuous growth process. And so even for all of us who are here, we're continuously learning about ourselves, continuously fine-tuning who we are and how we show up. And as Libby was saying about being humble, when you're interacting with people who look different from you, whose experiences are different from you, there is a way that you approach it. In order to get to relationship and connection, it's about asking people questions, right? So sometimes it's less about, how I want to show up, but what is the need for the person who I am connecting to and talking to? What is the need? Can I ask them, how I can support you, rather than thinking that I know how I can support them. I know exactly what they need, because oftentimes we don't. The other point that I will add is part of being an ally is also about being able to speak up, and rather than calling people out, being able to call people in. And oftentimes we've all been placed in these scenarios and situations where after the fact, we're like, I wish I had said this. I wish I had done that. And when you talk to your colleagues and your friends and people who you're trying to build rapport and relationship with, if you ask them about some of the experiences that they've had, they might be willing to tell you. And together you can think about what are some of the best responses. The way that I like to think about this is pilots. When pilots train, they don't just train for the best case scenario, right? They're training for all different sorts of events and eventualities that could happen. And hopefully they never do. But when you interact with people and you ask them about the scenarios and the situations that they've witnessed, that they've experienced, you might then have a sense of what you might be able to do and how you might be able to support an allyship in those experiences should they happen in the future.
You know what, the communication piece that you mentioned is really important too, because we always talk about amplifying voices. And to me, an ally, you have the mic all the time. Pass the mic, pass the mic. Like when you have the opportunity to speak up and speak out for us, don't just do it for us, but you take the microphone and you pass it. Pass it to the person to help them amplify their voices. And you get that in itself is a privilege. It is an enormous platform for all of us to be able to speak our truths. And so I say, pass the mic, and let us all amplify our voices.
Yes, Deneen, and the one, I love that, pass the mic. But make sure you have people who are around you, who are diverse, who you can pass the mic to.
Yes.
Because when you think about the number of people who are in your personal space, how diverse are they? Who's coming to your dinner table? I mean, I know that COVID is a thing, but it's still a thing. But when you think about who are you inviting over, who are you connecting with, are they diverse? Because if they're not, then the chances are that you can't pass the mic to somebody who has the background, who has the experience, who needs to be elevated. And that goes back to being able to make sure that you understand who you are, what your biases are, and to make sure you're open.
Someone asked how to deal with or communicate with individuals who are racist, but do not want to be known as such, or they are denying that they are.
Call them out. Call them out. That's what I say. I think we have to, for so long, there's like this tightrope mentality. We gingerly approach or not approach. We kind of, stay aloof from the person who is racist. But I would like to see our allies start to call out people when they see things that are not right. To me, that's showing solidarity, that's showing a commitment to this. And I want to believe that we've got enough armor on us that we can start to call people out and say, that's not right. I think we're all adults. Use your words, use your grown-up words, pull people to the side and let them know when they are doing something that is discriminatory. It's not right. When you're a misogynist, when you're using microaggressions, when you're saying things that are ruffling feathers and ruffling the souls of people, be able to call them out. I think as long as we safeguard comments and racist anecdotes and people who are, for the lack of a better word, they just don't want to see good prevail. We've got to start to speak out and speak out for those that look like me, for people around us who look like me. To me, that's, if you're going to be an ally, then you have to have that armor on you. You've got to have a backbone, and you have to be okay to be in this village, in this community of being able to call people out. And that's the only way, I think, that they'll be able to have a mirror up to their face to see what they're doing that's not right, and it's not all right with you.
When I think about this question, I think one of the things that needs to be done is for people to really understand what the term racist means. It's very unique how African Americans are defined, especially African American women. Idola and Denise talked about passing the mic. Sometimes you have to use a bullhorn to get the measure out, but when women tend to do it, they tend to be viewed as being angry or hostile versus being passionate, and I'm tired of being overlooked. I think everything that Denise stated was spot on, but a lot of times those that are viewed as racist tend to use victim ideology. So it goes back again to the self-assessment. Who wants to look within themselves and talk about their biases and bigotries? We all, irregardless of your ethnicity, have a certain amount of bigotry. And if you look at the definition of the word bigotry, things that you just don't like because of. But when it comes to people, and you look at the particular vernacular that are used, such as minority, as an example. Now, for me, that's a trigger word, because again, if I'm born in the United States, how am I a minority in anything if race is not biological, but it's a social construct? Yet, folks want to do it based on the amount of melanin in my skin. So, as a person of color, and as a person that suffers from a number of comorbid conditions, you never hear people say, hey, you're the majority when it comes to kidney disease, or you're the majority when it comes to diabetes, you're the majority when it comes to cardiovascular disease, or whatever the affliction is. But it's always a minority when it comes to race, and it's dehumanizing, and it's belittling an individual instead of just looking at the person's humanity. And I'm not saying that you should overlook a person's ethnicity, because you shouldn't, because it is important. And this is where the communication comes in. If you don't understand anything about a person's history or background, here again, we've been preaching since day one about the table in this DEI work group. This DEI work group creates a safe environment to have these conversations without any judgment, without any slander. We learn about each other. And what a lot of folks don't understand, even within the dynamics of the DEI work group, just because it's a group of African Americans, all African Americans don't come from the same place. They're not of the same origin within this country when it comes to psychosocial economic means. Some of us come from poor backgrounds. Others of us come from maybe middle class or upper middle class backgrounds. Yet and still, everybody gets lumped in based on color versus privilege. And sometimes there is privilege within ethnicities. I mean, if you look at it within the African American culture, God knows you have colorism. Folks don't think about that. Light blacks versus dark-skinned blacks. And that tends to create certain biases within, within our ethnicity, no different than when you look at Hispanics. You have white Hispanics versus just Hispanics, Latinos. And that creates certain biases. So when you talk about folks that don't want to admit that they're racist, I would just say you really need to, you really need to stand firm in your humanism, how you want to be respected, how you want to be viewed as an individual, and just you just have to elevate your voice and to speak out against those particular biases that people really want to use against you.
I'm keeping notes. And so I had like written out privilege. And so Patrick really like drilled that home. So thank you. Because I think we each forget that we have a certain amount of privilege that allows us to be able to speak up and say things that other people can't, right? As a white woman, Libby has a certain amount of privilege that allows her to be able to call in instead of calling out. We're going to be nice. We're going to call people in a very different way than I can, or than Deneen or Patrick can. And so I think we have to recognize what our privilege is. The other thing is everybody has a different capacity to speak out. And I, recognize that, and I've seen that over the course of my years. People have fears. They are scared that they might lose something as a result of speaking out. And you have to reconcile that within yourself. If you really want to be an ally and you want to be here for the cause, it might require you to lose something. But you're not losing something else that somebody else doesn't have, right? Like you got to keep that in mind. But I would start by saying, maybe we should call in people who are doing things out of bias. Let's not start with racism. Let's start with bias. If you see confirmatory bias, right, where people are just going to gravitate towards, the things that other people are confirming. If you see immediacy bias, where people are kind of just going with the thing that's right in front of them, call them in. If you see cut off women when they're speaking bias, call that person in. And the way that we do that, I'm a firm believer in when you tell somebody who they are, rarely will you see positive changes because they're seeing this, right? But if you can ask people questions that make them think and explore their own behavior, just maybe they can start to understand that, oh, something isn't right here, right? Like, do you notice that sometimes you have a tendency to do this? Like that is one way. Another way is when you see something, just say, oh, right? To have a visceral reaction, sometimes it's enough for somebody to realize that they've made a misstep. And It doesn't always need to be, like putting yourself in the line of fire. There are times where, so that said, there are times where you may have to put yourself in the line of fire, and to be prepared for it. And I think that's why it's important to kind of create these drills for yourself, right? If you see somebody who's experienced something and you think that that is racist, how is it that you want to handle that? Know ahead of time before you're even, up against that. So I think that we all have privilege. We need to understand that, and reflect on that and use that where it's important. And then realize that there are many ways that we can speak up and speak out and call people in.
When I saw this question, I'm like, God, that's a really tough one. Because I'm not sure you can force anybody into this work directly. I'm just not sure that it really works that way. But I think of my own journey and knowing that I had personal witnessing inequities in the health system, right? With people that we were hospitalized with over the years, and I saw it. And we made a strong commitment to diversity and inclusion at the outset of the organization. But it wasn't until 2020 where I realized we were not doing a good job living out those values and what those meant. And I remember an early meeting, I said something, and Ayadola's eyes popped out of the screen and came all the way across the country at me. And I was like, oh man, I stepped in it. And again, having to be humble and learn, what did that mean to Ayadola? And I think I asked you, Ayadola, how did that land on you? Because, and you explained that I had committed a microaggression and I wasn't familiar with it. And so I think that there's this continuous need to expand the number of people engaging in this work. And there is room for everyone in this work. I really believe that now. I think that we have to each take that personal journey to educate ourselves, to create awareness, and then be able to share that awareness with others around you. And I think that's, in my mind, building in an environment where it becomes, you get that look or you get that feedback. It becomes uncomfortable. I think that paired with the awareness leads people in an educated direction, if that makes sense. But yeah, because I had my own journey in this and recognizing that I was being insulting and not intending that. That wasn't in my mind, but that is how it was landing on people with the lived experience of being Black in America.
How do we help everyone in healthcare recognize the need to address equity and diversity needs when many do not see the need to address diversity, equity, and inclusion?
So I'll jump in right off the bat and let you know what I feel like it just needs to be in our language every single day. I think that we also need to really be thoughtful about what diversity and equity means and be really broad in our thinking about humans in America needing access to quality healthcare. Because I think, our experience has been there are certain areas of the country that maybe don't have as much racial diversity. That's not the only sense of diversity. How are we engaging our communities that are differently abled, or our aging communities, our pediatric communities? There's so many different ways to think about this. And I think we really need to help people expand so that they don't have the opportunity to sit back and think, that doesn't apply to our hospital or our healthcare system.
The one thing that comes to mind for me is this need to essentially show your homework. Right? You remember when we were, in school in math, and you might have been able to get the right answer, that we need to address equity. That is the right answer. But your teacher wanted you to show your work, to show how you got there. And I've found that for a lot of people, that's what they need. I remember when I was working at Brookings, and we were supposed to address equity and address this. It was framed as address disparities, and people said, "Oh, but there's no disparities by race, ethnicity. It's just gender. It's income." And that meant that we actually we couldn't start from, we need to address equity. We needed to start from here's the problem, and we needed to show the work. And so I think that that's just important, and being able to not just show numbers, but to show and share the stories that go along with those numbers are also really critical. There's a book by Dan and Chi Heath called Switch. And it talks about how we each have either, well, in us, we have both a writer and an elephant. The writer is the more analytical, logical side of us, and the elephant is our feelings and our emotions. And, you know, the elephant sometimes can just be so stuck that it doesn't matter how much information you share, unless you're able to approach the emotional side of things and touch the emotional side of things, you can't move people. And so you need both the data and the stories to really allow people to move towards what is right.
What you said, Adela, made me think about more people, especially in healthcare, seeing equity as a moral issue too. You know, if we're going to tap into emotions and feelings, it truly is a moral issue. And we don't talk much about accountability. So when you say to do the homework, you want to see how you got the answer, like where's the data, where's the work you've actually done, and who are the stakeholders to make sure that these organizations are being held accountable? Well, you and I are stakeholders. We're stakeholders, but then there are people within our healthcare systems and larger systems who have stakeholders. And I think we all need to look at what's our accountability and knowing how they actually reach the answer. We know what we want the end result to be, but I'd like to go back and I'm with you, because I tell you, I was the one that wanted to do like the short division instead of the long division. We got some people in healthcare, I promise you, that want to do it the short way and skip all the steps and carry the number real quick to get to the answer. And they say, I did it too. I just did it differently. Well, no, we need some accountability. We need some people who are honestly going to step in and say, you know, and did you really derive to this answer? And you're not done yet. When you get to the answer, you're not done. As long as there's one patient, one family member, one community member that's still dealing with inequities in healthcare, then we've still got work to do. Like the problem doesn't end. So I just want us all to remember that there is, outside of the data part, outside of accountability part, there is a moral issue that we should be tapping into as well with recognizing and addressing equity.
No, I was once told the most dangerous part of your body is the 18 inches from your brain to your heart. 18 inches. Imagine if you would leave those 18 inches unobstructed. Imagine if you took the word listen and look at the word within the word, which is silent. Listen with the intention of caring. Listen with the intention of wanting to make a change. Every day, there are people from marginalized communities that are engaging with medical providers, and a lot of people want to say that they're complaining, but they're voicing their concerns because they too deserve to be healthy. But a lot of times their concerns fall on deaf ears because a lot of those medical providers don't come from those communities. They don't visit those communities. So morally, they don't understand what's going on. I just think if we took away the obstruction from that 18 inches and just learned to listen with our heart and think with our minds, to be silent and listen with the intention of, you know, I'm going to do something just because you told me this today. I don't think that you're lying coming in here. I don't think that this is an issue that you need to tackle with on your own, or to battle with on your own. I'm going to do something. And in the midst of your listening, allow your actions to be greater than your words. See the person that's in front of you as a human being, not just somebody you just want to check off your list and then claim that, hey, I'm not racist because, you know, hey, I saw somebody that didn't look like me, or I talked to somebody that didn't look like me. But if you can't make that change, irregardless of how minute the change might be, it's a start. If you can just start from somewhere, you can start with your 18 inches from your brain to your heart.
One question that we got so much and something that I think a lot of healthcare organizations continuously struggle with is the want and need to develop diverse and inclusive patient family advisory councils. Many participants from the workshop wanted to know your thoughts on how to successfully do that.
The first step is reaching out to try your community healthcare centers. They have people who are going to community healthcare centers who look like me, who are a minority population of individuals and patients and families who serve particular communities. And if you want to have their voice, go and reach out to them. They're still using your hospital systems. They're still using the specialty care services. And not only that, there are fraternity and sorority of the Divine Nine organizations who are actively doing work in healthcare. Reach out to them. You know, I'm a part of one. Patrick is. I'm with Delta Sigma Theta Sorority Incorporated, and my brother of Omega Psi Phi fraternity is right here on this Zoom call. A lot of us are participating across the board, nationally, globally, in health arenas, and we're touching patients and families every single day. And sometimes it's just simply having a correspondence sent out, or go to the organizations, go to these meetings, go to community fairs. I mean, some of the stuff is right there in your newspaper that you get every day virtually. They're on bulletin boards, they're in your local grocery store, and you just have to reach out and show up. Show up as the ally, go in, learn a little bit about the organizations and tell them what you're trying to do. But more importantly, I say, look at what's your interview process? What's the application process look like? How many hoops people have to jump through just to become a member? You know, I'll say this, I've talked to a couple of families and some of them vary. You know, we do the most background checks, and a lot of times the meetings are virtual. What I'm trying to figure out, I'm still trying to figure this out. Why does the person's credit score, what does that have to do with your participation and volunteering in a PFAT? I mean, we just got to be real and go back and look at the processes that are in place, either to draw people in or keep people out. Go back and look at your process. And then where are you? And go back and look at how you've been actively or inactively seeking to get diverse populations at the table. What have you done originally? And if it's nothing, then start there. Community healthcare centers. Some of you have physicians and doctors who are Black and Brown individuals that you can go to. They can recommend patients and families who would probably want to serve. And then there's the clergy. There's the Black religious organizations right there in your community. Go to a service. Reach out during the week. Say that you have this opening. What about radio and social media? We do it all the time for everything else, but for some reason, we get a little, I don't know, we tiptoe around reaching out directly into the community. And you will not, I promise you, you will not have a problem getting somebody to the table if you just genuinely take first steps, these small little steps of reaching out. And then again, it makes no sense to reach out And then your application process looks like something to get into a federal program as an employee. That's a huge turnoff. I mean, I did it. I knew how important it was, but there's so many people I want to bring into the table, and they say, oh my gosh, it was like a 15-page, my interview process. I sat across from 6 people, like nobody's paying me. I'm volunteering my time, but I felt like it was an interrogation. So I think we need to start looking inward at what that process looks like. And I can go on and on and on, but I'll just stop there because I really want you to tell me, what have you done so far? How have you reached out so far? What have you done in your allyship work to actually connect with people in the community that you want to bring back in and be a part of your PFACs? So that's a start. And just give me a call, I'll help you.
Not to make this into a religious thing, but when you look at the definition of minister or ministry, it means to serve. For me, it's real easy. I can go into any community I choose. I may not be liked. It don't mean I won't go in there. But I'm going in there with the thought that I'm going to accomplish the goal of getting to know somebody. And this is very unique for me since I'm an introvert with extrovert tendencies. I've been told on a number of occasions by doctors, scientists, and researchers, especially sitting on a number of research committees when it deals with African-American medical research issues, that, oh, nobody wants to hear from an old white guy or old white woman, but they'll listen to you as if we, as a Black person, don't have hurdles and hoops and barriers to get around just to go in our own communities. And people have this this ideology, well, if I'm not Hispanic, then I can't make a difference in the Hispanic community. If I'm not white, I can't make a difference in the white community. If I'm not Asian, I can't make a difference in an Asian community. Well, if it's set in your heart to serve a community, it shouldn't make a difference what that community looks like. Even as a minister, I can go into the LGBTQA community and make a difference because I'm going in there with an open heart to serve, not to judge. And you'll be surprised at what you can accomplish. As an example, last Thursday, my organization partnered with another organization, and we did a heart-to-heart program for African-American women dealing with cardiovascular issues and some of the biases, the institutional and systemic biases that they had to deal with. Now, imagine myself and a white gentleman going in to deal with women issues. And yet and still, there was a breakthrough. Nobody looked at us as, white man, Black man. They looked at us as concerned people, sitting there quietly, listening to their concerns, listening to how they've been mistreated. These folks didn't know us. Here's the interesting thing. We never asked their names. Folks, all they had on was a name tag with a number, because we were so, we wanted to protect everybody's privacy. Okay? And yet and still, it felt like we knew these women for decades. Matter of fact, I even asked one to adopt me into the family because there was so much transparency. It was almost like sitting in a sister circle and being an honorary sister sitting there with them. We laughed, we cried, they shared. you couldn't ask for this. This was the community. And when everything was said and done, you know, I sat there and I reflected on it, and I'm like, wow, this should be what the world looks like. We should be able to walk in any community and say, hey, I want to help. I'm just going to sit and listen, and you talk. And if I have a question, raise my hand. Because before I can help you, I need to help me understand you. I need you to understand me and my shortcomings before I can help you. And I think if we take that approach, instead of, when we say we want to help, we tend to build walls. And we're already trying to go through a wall. But then we go around the walls that we have built just based on our biases and perceptions of folks, or our fears and trepidation of saying, you know, I can't do that. I can't change my thinking. That's y'all problem. You know, these particular words that don't speak life, but they just speak death in the situation. We had an opportunity to speak life into people. You know, I was always told by my grandmother, never use a word, any word with an N apostrophe T. And I remember she would discipline me if I said, Grandma, I can't do that. You can do that. You just have to choose if you want to do that. So for the folks that may be viewing this, I challenge everybody, if you want to make a difference in your community, don't ever use a word that ends in N apostrophe T or the word not. Don't say cannot, will not, shall not, not. Stop using that word right now. And I guarantee you, you and your community will change.
And I can't add anything else beyond what Deneen and Patrick have already said. I will just say that what they've said reminds me of a quote or a saying, seek first to understand rather than to be understood. And I think so many times we go to people wanting to tell them what we're doing, wanting to tell them how they can participate and engage, but we don't understand who they are. We don't understand their experiences. We don't understand what matters to them. So seek first to understand.
I think in terms of moving to a diverse PFAC, I mean, yeah, you guys have all said it beautifully. One thing that we as an organization have really focused on is focusing on inclusion rather than diversity. So how accessible are our meetings? To Deneen's point, is it burdensome to become involved or engaged? And so we've really looked at a more open-ended model. I think the PFACs are really great, and they can have a symbiotic relationship with a larger, more open-ended sort of a model. And so at this point, that's really what we try to do is take all of the expertise that you've just heard from Deneen and Patrick and Ayadola, and create more doors in the community so that more people can get involved in the way that is most effective for them, the most efficient for them. Have lots of different kinds of activities, more than just a monthly meeting. Have listening sessions, coffee chats, whatever it might be, other avenues for people in the community to inform your organization. I think diversity will come through inclusion and accessibility.
So the final question that we have, and I know each one of you have been instrumental in ensuring this at PFCC Partners and for the PFA network, but we were asked what methods are most successful in keeping diversity, equity, and inclusion on the front lines of company objectives.
Well, for me, it's just looking at the human aspect of it. You know, whatever the goals are, the mission, the vision, the objectives for the PFAC, I would wholeheartedly, you know, try to enforce that. And also at the same time, you just want to make sure that you have a code of conduct to make sure that you respect everybody's voice. Everybody's voice is equal. Their opinions are or should be very thought-provoking. Everything should be very engaging, and it should not be any type of dominance in there. And let's take our DEI group. From the beginning, it has been women heavy. And I have no problem with that because I know how to play my role. I listen intently because in my mind, women of all races tend to be marginalized. So when I think about diversity within a PFAC, when you treat everybody like human beings, you cannot go wrong. When you respect all voices and all opinions, you cannot go wrong. When you come in with a mindset of you're going to accomplish something, and you have goals that you want to accomplish, and you work toward those goals individually and corporately, to me, that's what a successful PFAC looks like. It's no fluff. It's no hitting the checklist, trying to recruit folks just for the sake of saying, hey, I have these folks recruited. You just want to have a safe environment to be able to share, to be able to engage, to be able just to have a conversation about the work and how it can impact change in somebody's life, to even include changing you as an individual. And that's what I give Libby credit for. And again, Libby, I'm going to say this till the wheels fall off because this is the truth. When Libby wanted to start the DEI work group, that was a very brave step that she took. And one of the concerns that we had was not for ourselves, but was for Libby, because we knew that this wasn't a popular move. But I don't really think Libby was really trying to be popular. Libby was trying to get the work done. Libby saw a problem, and she saw a need to address the problem. And we felt that. And I know for me, that's the reason that I said yes. And I haven't looked back. Has it been rough at times? Yes, because it's supposed to be. There's nothing in this world that should be easy. And certainly when you're talking about equality for diverse people, that's going to be rough because you're going to have some folks that flat out don't want it, some people that are against it, and some people that just don't understand. And that is fine. But when you have a diverse group that's working together, it becomes a family. It's not a corporation anymore. And you know how we are about our families. We will defend our families to the end. So this is why I really have to take my hat off to Libby, because it was one of the bravest things. I'm not sure if this is the bravest thing that she's done. It's the bravest thing that I've known that she's done. And because of what she's done, I now have a new family. And I'm going to fight from here to hell and back. Notice I said back. I'm not dwelling there. I'm coming back. But I'm going to fight for my family. So Libby, again, thank you. You can't not take the credit for what was put in your heart. You utilized that 18 inches for good, which caused us to utilize ours. So now, corporately, look at what we're doing. we are creating change. We're addressing concerns that are within the organization. And hopefully in addressing those concerns, people will want to change. People will finally understand, hey, there's a need for diversity, equity, and inclusion, with the key piece being inclusion. Let everybody be accepted as human beings.
Thank you, Patrick. You're amazing. And I have been truly blessed to have this group to guide this organization towards at least all of the work. You know, I don't think it ever ends. It's just the way that we do work now. It's not, we're never going to reach that point. I don't think that because you can't ever sit back and think, okay, everybody's okay now. And that was an adjustment that I had the privilege of making with all of you. So we have definitely been on this road together, and bumps and potholes and everything else. But I think, you know, what I've learned from this group as well, in terms of an organization and organizational leadership, you know, it was really easy to write that statement in May of 2020 to support equity and to be a committed organization. I look back at that, and I wrote a statement just like everybody else. And I look back at it now and I'm like, cringeworthy, because I've learned so much. And one of the things that I've learned is that it's almost like it's come full circle, because I wrote that and yet at the same time really didn't understand what I was committing to until I started to do the long division and get into the work. But then I kind of stopped talking about it at some point along the way. I think I was unsure where my feet were and what our organization unique contribution could be. There was unsure footing there for a bit. And so it didn't really talk about the work that we were doing a whole lot. And I didn't show anybody outside the organization the long division, right? And what I learned from this group, even recently, even in the last 6 months, is this commitment has to be visual to people who are going to our website and looking at our mission, vision, and values. If they're reading that and not seeing it, then they're not getting the full picture of who we are. And so I do think that those articulations, once you really know what that means to you as an organization, once you know as an organization how you put those words into action, because I think we were kind of backwards, because I think we had a lot of actions that spoke to our commitment, but we didn't have any words that spoke to our commitment. So I do think that is important, not only for the accountability piece and the North Star of where you're going, but also so that others see you as a committed. They know what they're getting when they contract with PFCC partners and the entirety of the group. And I also think that you know, there are starting points. So one of the things we really looked at early on was diversifying our workforce, right? We're a family-driven organization, so we all sort of look like me. And that was really a big challenge, considering we didn't have open positions. We didn't have finances to create positions. And so how did we do that? So thankfully, we have advisory boards. And so we were able to diversify those immediately. And through those advisors and that influence in the DEI work group, we had this just explosion of perspective in forming our organization. And so I think when you take those steps, now we do have a diversified workforce. We do are making these advances. We are not there by any means, but we are making advances. So I guess I'm sort of rambling, but I think just my more recent key learning is you have to know what those actions mean, or what those words mean in your organization, what actions go with them. And you also have to articulate those words.
That was well put. And it resonated with me. It made me think about you know, just growing up as a child and looking at that family component and the value system that's in the house. and how the interactions in the house, however good they be, staying in the house, at some point you got to walk outside. At some point, you got to be with your family or be by yourself, and you represent the family. You still represent what is happening within PFA Network and PFCC partners. And so that makes me feel so good that you value the work and that you've looked at the mission statement and our value statement, and you've said, listen, it's gonna match my commitment, my overall commitment to diversity, equity, and inclusion. And I'll not only do the work inside the house, but I'll make it so when you walk out that everybody sees that representation. And that it warms my heart, because there's so many organizations that they say they do the work and it stays inside the house. It stays within the four walls, or it only goes up to so many floors and it doesn't reach the executive level. It's like, do as I say, not as I do kind of thing. And that doesn't happen here. And so that whole authenticity of what you're talking about, I can feel it. And, you know, as a woman of color, I feel it. And so when I step out, it makes it so much easier to be able to represent the organization. It does. And it's so genuine, and it comes across, and it makes other people want to come in and be involved. So thank you for that openness. I really appreciate it, Libby. And the transparency. Transparency is important. It's so important. So
It's a superpower.
it is. It really is. And you have it. You have it.
I completely agree. Transparency is a superpower, and in some ways, you know, I think accountability it goes hand in hand with that. You know, I think that one of the things that is very clear in terms of what Libby has done is she evaluated her organization. She evaluated, you know, herself, the role that, you know, she played, that each of her staff played, and that PFCC partners played, and then the system in which they operated. Because I think it's very easy for us to just adopt what has already been in place and not question it. Have we ever questioned why we go into an office setting in the summertime and it's 72 degrees or 68, 70? Have we ever questioned that? You know, have we ever questioned why meetings, you know, with, you know, patients and family advisors start at 3 p.m. because that's just the way that it's been done. But really, the way that institutions, the culture that's been created, oftentimes it's been created with a lack of diversity, with a lack of equity, with a lack of inclusion. And so it's really important for us to interrogate the way that we've been doing things to see if things need to change. So I think that that's number one, and really ties to transparency and accountability, right? Tell people what you found, and then tell people what you're going to do, but don't just stop there, show them. You know, there's this saying, your actions are speaking so loudly that I can't hear you. Don't let that be the case. Tell people what you're going to do and then back it up with your actions. The other thing that I think is important is perhaps finding ways to consistently evaluate things. You know, we brush our teeth every day. Nobody, you know, you might not need a reminder. Hopefully you don't need a reminder. But what are the ways that you can connect the understanding, assessment, and evaluation of DE&I into the way that you already do business, right? If you are on a weekly basis showing dashboards, a monthly basis showing dashboards, reviewing things, incorporate your DE&I accountability and transparency there. You know, figure out ways to hold people within your organization or within, you know, the role and the you know, authority that you have, find ways to hold them accountable. If you're at very senior levels, maybe you need to tie compensation to DE&I goals, right? Maybe you need to think about, you know, the role that each of your staff play. And yes, somebody might be an administrative and assistant and they have gatekeeping authority, how can you assess and make sure that in that role, they're adhering to the DE&I practices that you have established, right? So think about what the processes are that have been in place for so long. Think about how they need to change so that they reflect the DE&I. Find ways to be transparent and hold yourself, the people who work with you and your organization accountable. All of these things are what Libby has done, and it's just a really amazing example of what can be done when your heart is in it and you're listening. As Patrick said, you know, the focus is on the 18 inches between your brain and your heart.
Well, thank you, each and every one of you. I've been taking notes this whole time because
I'm still learning. Me too.
Despite, you know, the 2 years that we've spent together, I still learn something new every time we meet. So thank you for your additional time today, for responding to a few of the questions that we got in the workshop. I really appreciate it.